I'm Robert Thornton, Principal Consultant at Motivation Plus and a member of the Authority Health Board of Directors. To commemorate Men's Health Month, we've invited men from the African American community to talk about their commitment to improving their personal health. Our theme is, when this is over, I'm going to be a better person. It's no secret, this coronavirus pandemic has devastated the Black community. Many of us have lost several family members and friends to this disease and know people who are still recovering. We now know that our health going into this disease or any disease influences how well we're able to recover from it. This pandemic has not only revealed gross disparities among African Americans who have died from the coronavirus compared to the overall population, but it also has exposed broader health disparities facing Black people in our society, and particularly Black men. Our message today is a simple one. It's about taking personal responsibility for our health. Men, it's not about relying on doctors and drugs to get us through life, but working with doctors to achieve optimum health and not to rely on drugs if possible. In this program, we're going to focus on men who have recovered or who are recovering from COVID-19, as well as men who are focusing on how to improve their health. I would like to take a few minutes to share my personal journey. In December of 2018, I retired from my job as a senior program officer with the Skillman Foundation. Over the Christmas holiday, I took time to review photographs from my retirement celebration, and I did not like what I saw. It was obvious that I was carrying far too much weight. I was 5'7", 230 pounds, a recipe for disaster. After reflecting on the loss of my eldest brothers 2 years prior, and the fact that my older brother, who was 2 years older than me, was confined to a nursing facility following a life-changing stroke, I decided it was time to get serious about managing my health. So I joined the local weight loss program, and with their assistance, adopted a healthy lifestyle change, which I practiced with fidelity. And thus, 15 weeks later, I had lost 60 pounds. As a result of my weight loss, I no longer require any of the medications I have been taking for several years to manage my blood pressure, my cholesterol, my acid reflux, and a variety of other things. A lot of people say when this is over, I'm going to be a better person, kinder, more focused. I am one of those people. I truly believe that and hope to be a better person than I am today. Not only a healthier person, but also a more outreaching, more supportive, helping others to improve their quality of life as well. A recent poll of minority men conducted by the Kaiser Family Foundation found that 27% of Black men did not have a primary health provider, and that 16% did not even go to the doctor on a regular basis because of cost. In addition, nearly 25% of Black men report fair to poor health. We can change this. Men, we can do better. In today's program, we will hear from men who are leaders in our community and who are focused on leading healthier lives as we come out of this pandemic. Joining us today is State Senator Marshall Bullock, Detroit Police Chief James Craig, a COVID-19 survivor, Mr. Kurt Swanson, also a COVID-19 survivor, and Dr. John Sealey, a retired cardiothoracic surgeon and consultant to the Authority Health Graduate Medical Education Program. So let's get started. Now we'll hear from State Senator Marshall Bullock.
Greetings. I'm Senator Bullock in the great state of Michigan. I'm just here to rap about the importance of Black men to make a commitment to a healthier lifestyle and to get other brothers involved in the community to be healthier. I'm a husband, a father to 3 teenage high schoolers, 2 young ladies and a young man, and I work hard every day to change their future, your kids' future, our future, and also prepare them for the pitfalls of life and be successful and problem-solving skill set. Yeah, we understand that the COVID-19 has devastated Black and brown communities due to a variety of issues, mainly pre-existing healthcare disparities. And Black leadership has been fighting and demanding some accountability since the days of Frederick Douglass. I, as the chairman of the Michigan Legislative Black Caucus, We have been working hard to address these issues today: healthcare disparities, education inequities, workforce labor imbalances, criminal justice biases. And we know that the number one predictors of life expectancy for Black and brown communities in America are the lingering effects of redlining and the invisible zip code barriers that determine our education, job status, family, social support, income, community safety. But the question we can ask is, what can we, the Black community, Black America, do on its own, even under these conditions, to combat these blatant disparities? So for me, it makes no sense to wait for the cavalry, right? Or the elected administrations to put in legislation that is going to change these things, especially when there are things we can do on our own. Yes, I'm a spiritual soul, yet beyond that are the three tenets I learned in scouting. The first is to keep oneself physically fit. Second, to be mentally awake. And third, to stay morally straight. Look, I lost my dad to unhealthy habits when I was in my late 20s, and my mother to disease right after I hit 40. So what I'm choosing to do is eat healthier, exercise. I don't smoke. I got a primary care physician, and I make my annual and benchmark visits. That is what we need to do as Black men. And when I first got elected in the state Senate, I created the Senate Slim Down Challenge with my colleagues. And we had a great first year. And the second year, just as we got started, we were hit with the COVID-19, and that put us on pause. But while we've been on this pause, we have been mentally, physically, and spiritually challenged with life, a virus, racism, and police brutality. And it's time for healing. And this pause is for self-diagnosis. My family's done some self-reflecting. We've proofread ourselves. We've opened up about our feelings. And that helps with your mental health. That mental health pressure is something that's a step that many of us Black men ignore, our mental health. We got to be tough all the time. We got to hold in our feelings. That's what men do, when really that's hurting us. We have to try to balance our mental health, our physical health with life in this Black skin daily. And that is exhausting, bros. So, talk to somebody, whether you can talk to a friend or a professional. Exercise-wise, me and my family have been walking more through the community. Me and my son have been riding our bikes as often as we can. It's almost daily in this new normal. But these aren't just the only strategies that will nullify poor health, but it'll put us in a healthier space of life. And that's all we can ask, is to put forth the effort so that we're better equipped to at least deal with some of the hardships that we know coming this way. So get some proper nutrition, get some physical activity, talk, and pray. Continue blessings and stay safe.
Next up, we have Detroit Police Chief James Craig, who himself is a COVID-19 survivor.
I'm James Craig, the Chief of Police for the great city of Detroit. But I oftentimes get asked the question, so when you found out you were diagnosed with COVID, how did you feel? Shocked, deeply concerned, again going back to those issues, but I wasn't going to allow myself to be consumed with doubt or fear. It was important for me to fight. Mm-hmm. Certainly like most Americans, and when the news is constantly reporting not those who are recovering, but those who are dying, and then the second part, that it's affecting those members of our community primarily that are 60 or 65 and over. So of course that got my attention. I'm not 65 and over for the viewers, but close enough that I was concerned. But again, I continue to rely on fitness, diet, just lifestyle issues. So I was primarily concerned with my heart health. I was really concerned about that because I had the underlying condition of heart attack. And we've heard the stories of so many deaths across this country, particularly those citizens of the United States in my age bracket who also had the underlying issue of hypertension. So it was important for me, once I was diagnosed with COVID, and like many, I was lethargic, didn't want to move, and pretty much the disease wants you to do that. I was weak and had no desire to get up. But, a lot of it has to do with what's here. Are you going to mentally overcome and punch this deadly disease in the nose? Well, one thing I learned, you hear so much, there's so much in the news about what you should do. They say vitamin D supplement is a great supplement to take to strengthen your immune system. Also vitamin C. I think those two supplements go well. Elderberry is another example. Echinacea. Those are things, I've always, studied herbal medicine and vitamins and minerals. And I felt like my immune system was getting stronger as I began to take these different minerals. When I look back, coming up on my 44th year of being in law enforcement, somebody said, well, Chief, you spent at least 10 of those years as a police chief, so you don't understand. Trust me, I do. The stress I had as a police officer is very different than the stress you have as a police administrator, particularly when you're the chief of police. And so I will consistently, constantly, urge everyone, take care of yourself, eat right, fitness, fitness, fitness. It may save your life.
Our next guest is a young man that proves this disease does not discriminate, also a COVID-19 survivor. We'll hear from Mr. Kurt Swanson.
Hi, my name is Kurt Swanson, a program assistant at the Skillman Foundation. On March 29th, I went to a local hospital because I was exhibiting COVID-19 related symptoms. After arriving, going through the screening process, I was turned away and redirected to a local pharmacy for Tylenol. And so 2 days later, I ended up going back to that same local hospital on March 31st, at which time I was put through another screening process and was not administered the COVID-19 virus test. On April 3rd, I had a call with my primary care doctor regarding my repeated attempts to be tested for the coronavirus unsuccessfully and how I felt my conditions was worsening. At that particular time, I had shortness of breath, fever, a cold, chills, nausea. In addition to that, the shortness of breath was getting to a point where I was really becoming even more afraid because my father had asthma and he actually passed away from an asthmatic attack that led to a heart attack. So my primary care doctor recommended that I go back to that local hospital immediately, but I told her that about my experiences there and how I went on 2 separate occasions for testing after exhibiting all of the precursory symptoms that would justify a test being administered to me. And well, she at that particular time said, okay, well, continue your quarantine process. She instructed me to hop on a call with her the next day, and if I was not doing any better, to go back to the hospital immediately. So on April 4th, I got a call from my doctor, and at that point, my shortness of breath had gotten to a dangerous level in terms of me hyperventilating and gasping for air after syllables. I needed to get to a hospital And so the EMS eventually arrived. It took me to a different hospital, this time on the 4th. And at that point, I was tested for the coronavirus. And it turned out that entire time I was in fact positive for the coronavirus. I had pneumonia, hypokalemia, low blood potassium, and I developed an asthmatic condition as a result of delayed testing. After all of this, I will prioritize my health and also prioritize making lifestyle change decisions that will improve my overall health and as well as get in the best shape that I can.
Our final guest is Dr. John Sealey.
My name is John Sealey. I'm the Director of Clinical Services for Authority Health. Today, I want to talk to you about men health. Why is that important to me? It's because a significant number of African Americans' lives are short because of not paying attention to simple conditions of health. Because there are about 7 diseases that African American men have, and most of them are preventable. Let's talk about them. High blood pressure, heart disease, prostate cancer, strokes, diabetes. Those are the diseases. They all are preventable. They should not take anyone's life. So physicians are very important on your team. That physician does a couple of things. One, he should be a person to help your education. That's so that you will be prepared if you start having chest pain, if you start having frequent urinations, if you start having any of the symptoms that might point towards one of those 7 things that you want to get away from, he will be there to help you do that. So he should be there, and you should visit him once a year, and hopefully each time you visit him, it will be a pleasant visit. But if you find that you have one of those issues that we talked about, he will be there to treat it and not treat that palliatively. Finally, 2 things that will allow you to say, I do this every day. The free checkups. If you get a chance to have your blood pressure checked up, have it checked. There's no problem with that. We can treat blood pressure easily. It's very difficult to treat renal failure, which is a consequence of high blood pressure. So remember that. So live into retirement, enjoy your retirement, and have a good time. Thanks for allowing me to talk to you today.
Men, we need to change our lifestyles and improve our health and help others to do the same. This program will be shared through many social media networks, and we are committed to putting the word out that men can lead long, healthy, and purposeful lives. I am hopeful that each of you viewing this program commit to changing your life so that when this pandemic is over, you will be a better and healthier man. I'd like to thank the men who have joined us today and who have shared their journeys and their stories as well. Finally, I'd like to thank the staff at Authority Health who work tirelessly to advance opportunities for the people in this community to ensure that they all have equitable access to high quality health care. Thank you and have a blessed day.